Hi guys, my name is Demetrius Howard, and I'm going to be discussing lobar pneumonia, specifically the typical CAP. So, lobar pneumonia, there's multiple different types of pneumonia. So, specifically with lobar pneumonia, it's going to be characterized by an acute infection and inflammation of one or more lobes of the lung, hence the name, um, which is going to result in the consolidation of the lobe of a lung. So, consolidation of the lung just refers to a buildup of fluid or solid within the lungs, which makes the function of the lungs go away, right? Such as like it's going to be harder to breathe, maybe coughing up some mucus, things like that, that I'll be discussing a little bit later. So typical cap is going to there's two different types of caps. So there's typical cap and atypical cap. Um, I'm going to specifically talk about typical cap, and so to break it down, cap is going to refer to community acquired pneumonia, which means that the infection was acquired within the community and not a hospital setting. And then typical is going to refer to the type of bacteria that causes the infection, such as Streptococcus pneumoniae, which is the bacteria that most commonly causes lobar pneumonia. Um, Also, bacteria that can be cultured on a standard media or seen on a gram stain are going to be considered typical. If the bacteria cannot do those things, then it's considered atypical. Typical cap infection occurs within the alveolar space, as opposed to just along the walls of the alveoli. So, if the infection is occurring within the actual alveolar space, then it's considered to be typical cap. So, some signs and symptoms that a patient might exhibit with lobar pneumonia is going to be high fever, chills, coughing up of mucus, chest pain, hemoptysis, which is the coughing up of blood. So, if they're exhibiting any of those signs or symptoms, then it could be a good indicator that it's lobar pneumonia. And I included an X-ray of lobar pneumonia, so you can see this bright area in the upper left lung. So that's going to be an indicator that pneumonia is present um, due to that consolidation. So causes, as I mentioned earlier, so Streptococcus pneumoniae is the most common bacteria that's going to cause lobar pneumonia. But there are other bacteria that could also lead to lobar pneumonia. So the pathophysiology, there's four different stages of lobar pneumonia, like infection. So the first stage is going to be congestion, which is going to occur within 24 hours of the infection. So what you're going to see is you're going to see more bacteria than white blood cells in the lungs. Um, and this is also where consolidation occurs due to increased blood flow. And you'll see some swelling of lung tissue as well. And stage two is hepatization. So that's going to occur 2 to 3 days after infection. So the affected lung is going to become more dry and airless, which could explain why it might be harder to breathe with pneumonia. And then the lung also begins to resemble the consistency of the liver. So once that consistency of the lung changes, you know for sure that you have progressed from congestion to hepatization. In stage three, with great hepatization, the lung's still going to have the consistency of the liver, but the difference is you would see the breakdown of red blood cells, and then the lungs will appear gray or yellow. And this typically occurs 4 to 6 days after the infection. And finally, the last stage is resolution. So normal lung function is going to return. This occurs typically 8 to 10 days after the infection. And you'll also see macrophages appear to get rid of any leftover debris. And so with the macrophages getting rid of that debris, you might see the coughing up of that debris, so like mucus and stuff. Some complications associated with lobar pneumonia is going to be sepsis, pulmonary abscess, organ failure, respiratory failure, and even death. And so the vascular ultrasound role with lobar pneumonia is going to be it can help identify lobar pneumonia, especially with the consolidation. So again, it's the buildup of those fluids. So you can see that on the ultrasound, and you can see where that blue arrow is pointing. That white circular space there, that's going to be an indicator that pneumonia is present within the alveolar space of the patient. And it's not just lobar pneumonia that can be picked up using ultrasound, it's the different types of pneumonia as well. So it can help differentiate between types of pneumonia as well. And research actually shows a very high sensitivity and specificity for um, identifying pneumonia using ultrasound. So it's also a great tool to use. And so for the quiz, the question I posed was: a student observes a microscopic image of a patient with lobar pneumonia. They noticed that the red blood cells have been broken down. How long would the infection have been present in the patient? So the answer for that is going to be 4 to 6 days because the appearance of red blood cells being broken down is a clear indicator that the patient is at the gray hepatization stage, which occurs 4 to 6 days after the infection.